Good morning, everyone. I'm Delano Manson. I'm the CEO for the Kentucky Nurses Association. Thank you so much for being with us this morning. Just want to go over a few logistics. First of all, we want to remain muted throughout the presentation. If you have a question, if you'll put it in the chat box, we would really appreciate that. And we'll get to that after each presentation. You may also raise your hand and we'll get to you and allow you to speak and ask your question if you raise your hand. So and also wanted to say that we have a special session going on between 10:30 and 12 o'clock. During that time, some of you will be selected to visit with legislators, and the others will be selected to participate in our trivia game, and where you will be able to earn prizes if you win. So there will be 30 questions that you'll get a chance to answer, and the first 5 people that answer all the questions and send their list to Sherry at admin at kentucky-nurses.org will win a prize. And we'll tell you a little bit more about that as we go forward. With that discussion, I would like to introduce our president, Donna Metter. Donna?
Thank you very much. Can you guys hear me okay? Can everybody hear me okay?
Yes.
All right, great. Thank you. I'm Donna Metter. I'm the president of the Kentucky Nurses Association, and I'm so excited to have everyone on here today. I know last count I heard was, I think, around 115, but I've heard a lot more dings as people have been let in. So I know we have a very large group with us this morning. So thank you all very much for taking the time out of your day. I wish that the skies in the Capitol looked like it does on the screen there, but instead we have a winter snowy February day. But that's want to welcome everybody. This is our first ever virtual KNA Nurses Day at the Capitol. We've done many Nurses Day at the Capitol, but we've always done them in person and been able to actually go into the Capitol building. So today we are coming to you virtually, and I think we're going to have a great program today. We have had more than 200 people register, and along with registered nurses and those of you who support us. So we really appreciate you being here. Our theme today is Together We Can Do It. 2021, the year of the Kentucky nurse, resonates with all nurses across the Commonwealth. As we continue to fight COVID-19, we extend our heartfelt thanks to the nurses on the front lines who fight this pandemic every day. And in honor of them, I have a brief poem I would like to share. The days and nights run together now. The need is growing in a way she never imagined. She helps patients who slowly recover. She cares for many who die alone in isolation without loved ones. She quit watching the news. She knows firsthand about the pain and suffering. She is tired and misses how life used to be. She struggles to find a new normal. Still, though, she forges ahead as vaccines and testing give her hope. Patients, families, and her team members depend on her. She will always do her best and give all her heart. She will combine clinical skills and best practices. She will not waver in her for those who need her most. No matter what, she keeps trying. She is a Kentucky nurse. So I want to thank whoever brought that poem to us. That's very beautiful and heartfelt words to all of you who are out there fighting COVID-19 and our communities get healthy. As nurses, we're called upon to help during this difficult time. I want to make a pitch this morning to nurses in our Bluegrass and Nightingale chapter areas to volunteer to provide vaccines for our legislators. We do that from 7:30 a.m. to 11:30 a.m. on Tuesdays and Thursdays, and we can always use more volunteers. So if you can help, please contact the KNA office. And speaking of the KNA offices, I want to take just a moment to introduce our staff at the KNA. I'm sure that all of you know Delano Manson, our CEO, who did introduce herself. Thank you very much, Delano, for all the wonderful work that you do and the leadership that you provide to this organization. But we also have some additional staff members that we want to recognize. One is Sherry Chandler, who has joined us recently. So Sherry is doing a great job with some of the administrative roles that we have going on. Also, Alicia Alvey. So I want to thank Alicia for joining our team also. We just have so much going on these days that it has been impossible to do all the testing and vaccination clinics and to really keep all that stuff coordinated without the additional help. And always Stephanie Smith, our wonderful membership and communications coordinator. So I want to thank all the wonderful staff at KNA for everything that you do to keep us organized and coordinated. Before we get started with our speakers, I want to remind everyone that we'll have a break from 10:15 to 10:30. After that, we'll invite those who have legislators available to accept the invitation to breakout rooms to meet with their lawmakers. We encourage you to begin thinking about questions that you may have for these legislators who are taking time out of their busy schedules to be with us. From 9 to 9, so we will have a legislative priorities review. And I guess I will turn that over to Delanor to go over that with us.
Well, actually, I would like to turn it over to Dr. Brittany Welch because she is much more informed than I am. So, Dr. Welch, would you do a legislative priority review for us?
Thank you. And thank you everyone for joining us today. It's such an honor and a pleasure to see everyone here for our Nurses Day at the Capitol. So the first priority I want to discuss with you is something many of us hold near and dear to our heart. It's the school nurse in every school, all day, every day. Senator Reggie Thomas has been a huge supporter of the school nurse initiative. He has previously been cited as saying Kentucky schools need a nurse in every school every day, as it shows improved attendance rates with lower absenteeism, enhanced school graduation rates, higher standardized test scores, a decreased need for local emergency department services, and reduced transmission of infectious diseases. So I want you to think about that. If we could ensure students are not only more likely to attend school, but also more likely to be successful in school and have better health outcomes, that's a huge area of opportunity. Putting a school nurse in every school has the potential to do something that we have long talked about doing as nurses, to improve the overall health outcomes of an entire community. We can change the culture of a community. Nurses know how culture plays a huge role in the healthcare outcomes and whether an individual will seek medical care appropriately, whether a community services will be overutilized or underutilized, and whether they trust healthcare providers, and whether a patient follows through with the recommended provided care. You may ask, you may have been asked, or maybe you asked, how are we going to pay for it? And the School Nurse Initiative group of the KNA has been navigating this issue for quite some time, and there's a variety of modalities that are being explored, from utilizing funding from the CARES Act to appropriately billing Medicaid for the school nurse services. That's our first priority. Our second priority is removal of the CAPA-CS for those who meet criteria. And Senator Julie Rocky Adams is a big champion of this. So APRNs have demonstrated the ability to care for patients safely, effectively, and autonomously throughout the US. And that's not rhetoric. Data actually supports the independent practice of nurse practitioners. Data suggests that nurse practitioners provide care to more underserved populations and more Medicare, Medicaid beneficiaries than their physician counterparts. They also have better patient satisfaction scores in a primary care setting. States that allow for fully independent nurse practitioner practice have a 50% decrease in unnecessary hospitalization rates. Think about that. Unnecessary hospitalization rates can easily be translated into improved health outcomes for an entire community. So I don't know about you, but it drives me absolutely crazy when I hear the argument that nurse practitioners only went to school for 3 years. Do you know anyone with a master's degree in nursing that only went to school for 3 years? The oppositional point of view may say that there are severely decreased clinical hours for licensure as a nurse practitioner versus the requirements of an MD. I recently read an article that was written by a primary care provider who argued that NPs only have 1 year of online training and a total 500 clinical hours. I'm not sure about you, but I would only have made it out of I wouldn't have made it out of an undergraduate program with only 500 clinical hours, let alone a graduate program. In this article, not once did he address the mounds of data and research that support positive outcomes. Not once what does it address that NPs care for more Medicare or Medicaid beneficiaries. Not once did it say that patients come first. He did say that if physicians continue to collaborate and sign off on the collaborative agreement, physicians will be obsolete, in which I would argue that he must have skipped that lesson in med school on the importance of collaboration amongst an interdisciplinary team. He must also not be aware of the large underserved communities or the large physician shortage of over 300,000 providers in the US. It's essential that every individual and legislator in Kentucky understand the ability of nurse practitioners to practice in Kentucky to the full extent of their education and training. And it's severely limited by the CAPA-CS. The collaborative agreement for prescriptive authority for controlled substances did not encourage collaboration. It's simply a piece of paper. It's an impediment to access for so many Kentuckians and inhibits nurse practitioners from practicing to the full extent of their education and training. The CAPA-CS must be removed for those who qualify. Nurse practitioners must be allowed to serve the underserved from Eastern Kentucky to Western Kentucky and our inner cities. They depend on the ability to access to quality care, and legislators and nurses must stand united on the topic for better health and community outcomes. And that's our second priority. Our third priority is the evacuation of surgical smoke, and that's filed by Senator Julie Rocky Adams, and that's Senate Bill 38. Understand that every year, hundreds of thousands of healthcare workers, including operating room nurses, are unnecessarily exposed to excessive amounts of surgical smoke in the operating room. Surgical smoke can contain over 150 chemicals, many of which are known carcinogens. They can be very dangerous. In 1996, 25 years ago, the CDC issued guidance on surgical smoke, citing that it's known to contain harmful chemicals such as cyanide, benzene, formaldehyde, bioaerosols, dead and live cellular material, including blood fragments, and viruses. These chemicals have statistically significant effect on our perioperative nurses, as they suffer from 2 times the amount of respiratory problems as the general public. Although the data and the CDC recommendations for having a smoke evacuation system in place has not changed, there's no federal legislation stating that an evacuation system must be in place in order to mitigate the risk to healthcare professionals. Many states have passed legislation mandating surgical smoke evacuation systems in order to decrease this risk of cancer and death to operating room personnel. Kentucky needs to ensure our operating room nurses, patients, and other healthcare workers are not exposed to harmful carcinogens. We must pass legislation ensuring surgical smoke evacuation systems are in place. And Senate Bill 38 mandates the use of these surgical smoke evacuation systems in our operating rooms. Our last but not least priority is House Joint Resolution 9 to increase access to SANE nurses. And this was drafted by Representative Stevenson. In Kentucky, 1 in 2 women and 1 in 5 men have experienced or reported experiencing sexual assault at some point in their life. Imagine that you were a victim of sexual assault, and when you felt the courage and the strength to seek help, you were told or you were put in a room alone for several hours and told to wait for a sexual nurse examiner. Or worse, you were told to go to another facility that could manage your care. How would you feel being left alone in that room? Would you feel safe, secure, and cared for? How would you feel being redirected? Would you feel the courage to go to another facility? Sexual assault nurse examiners, when available, provide the gold standard in care to victims of sexual assault. Victims cared for by SANEs have better overall health outcomes, and cases processed by sexual assault nurse examiners have higher overall conviction rates. KRS 216B.400 mandated that specially trained nurses or physicians be accessible in all hospitals throughout Kentucky. However, it did not attest to the necessity of timely delivery of services. House Joint Resolution 9 seeks to ensure that victims of sexual assault are cared for by compassionate experts in their field, in order to ensure all citizens throughout Kentucky have access to SANE services. Adequate data must be collected. House Joint Resolution 9 calls for all licensed facilities throughout Kentucky to submit data to the interim Joint Committee of Health, Welfare, and Family Services regarding the number of victims examined over a 1-year period, and the listing, title, license, and certification of the individual providing the exam. It also calls for analysis of the number of sexual assault nurse examiners employed by the facilities and their employment status, whether they're full-time, part-time, or contracted. It also asks for the recommendations of that facility on ways to increase the number of SANE nurses, so whether or not they need increased reimbursement rates. This will help in increasing the number of SANE nurses throughout our state. That wraps up our priorities. Now, if you're asked about a priority that's not one of our 4 top priorities for the KNA, it doesn't mean we don't support or oppose that priority. And you can navigate or locate those priorities by going to the Kentucky Nurses Association website, navigate to the left-hand side, going to Policy and Advocacy tab, and a list of our topics on what we support or maybe oppose is listed there. If you see a topic that we don't take a stance on or there's not a stated stance on, you can absolutely request that the KNA support an issue that's important to you by requesting it through that website as well. I want to shift gears just a little bit and talk about how KNA has made an importance in the community and kind of empower you to feel confident when you're speaking with your legislator. Throughout arguably one of the most trying years for many of us, KNA has sought to advocate, to educate, to serve, and really collaborate. As a nurse in Kentucky, the Nursing Association is your voice. And this past year, you have done some amazing things. KNA has advocated for nursing, for our patients, and for our communities on every level, from calling for appropriate PPE for our frontline nurses, for advocating for healthcare equity, for calling for underserved populations to have the care that they desperately deserve. You have worked to provide education. You have educated legislators, board executives, news anchors, and everyone in between on issues that impact nurses in the communities you serve. You have and will continue to make your voice heard. Your association has also served. You have provided COVID testing to underserved populations, to the individuals some of society seem to have forgotten. You have coordinated vaccination efforts. You have coordinated to provide mental health services to our frontline healthcare workers. You have bottled and distributed hand sanitizer. You have distributed face shields to healthcare workers. You and your nursing association have served this year. You have collaborated with legislators to draft policies to ensure better health outcomes for citizens throughout the Commonwealth. You have collaborated with boards, with provider groups, with hospitals, with schools of nursing, with special interest groups to ensure the needs of your communities are met. As one of the 90,000 nurses in Kentucky, I encourage you to continue to advocate, educate, serve, and collaborate, and feel confident because you have achieved amazing things over the past year. Thank you. Donna, you're muted.
Thank you. Sorry. My own unmute wasn't working, but they have given me the permission to speak to you guys again. So thank you guys. Thank you very much, Dr. Welch. That was excellent. That was an excellent presentation of the priorities that we have as a state nursing association. Next, we are going to have a presentation on advocacy and what is advocacy. And that presentation is going to be done by our very own Dr. Eva Stone. I have her CV pulled up here in front of me and it's quite extensive. So I'm sure she probably would prefer that I don't spend enough time to go over every detail of that. But let me just say she is well prepared for the role that she is in. Dr. Stone has worked in West Virginia, in Danville, Kentucky. She's worked in several different school systems. And now our Louisville area folks are very blessed and privileged to have her as the Director of Health Services for the Jefferson County Public Schools. In addition, Dr. Stone was recently the KNA Nurse of the Year. So I want to congratulate Dr. Stone on that excellent award. It's really intended to honor a member of KNA who's made an and significant contribution to KNA. So obviously Dr. Stone is a KNA member. She has worked tirelessly for a healthier Kentucky, specifically in the area of school nurses and the health of our children and students. So go ahead and turn it over to Dr. Stone, who is going to tell us a little bit about what she sees as advocacy in that role.
Thank you, Donna, and everyone for being here today. I'm very encouraged to see so many people interested in things related to nursing and ways that we can help make Kentucky a better place to be. And I think that's what everybody's goal is. And I'm just going to talk a little bit about advocacy. And I'm going to start by telling you a story, because I've spent the last 21 years of my career really working in school health. And I started out, when I first got out of nursing school, I worked in an ICU for a time. And what I found is I just didn't think that was going to be the best fit for me, because I felt like I needed to do more to help prevent people from ending up in the ICU, and ended up going to work for a local health department and really found a passion for public health. And then just some of my story, because we all have stories that lead us to where we end up. And it just so happens my father is a retired elementary school principal, and my mother was a nurse. And so I ended up finding my passion in the area of public health and working in school health. And so to kind of preface some of that, I'm going to tell you a story, and that is several years ago, in an area where I was working, I was contacted by the principal of an alternative school. And he reached out to tell me about a young man that he was worried about, who was sleeping. He was coming to school and he was sleeping all day, and he really wasn't sure what was going on with him, and just wanted to get some help. And so what we found out from this young man is that he had been placed in the custody. He was 16, almost 17 years old. He'd been placed in the custody of his 18-year-old brother, and their father had been sent to jail. There were some extenuating circumstances, and somehow this young man was placed in the custody again of his brother. They were living in a shack. We ended up going to the house. They didn't have, the only running water in the home was a garden hose to a kitchen sink. There was no hot water. They had no vehicle, no transportation. And it was just pretty deplorable. And we ended up, we actually installed a shower in the building where we were, not just for him. We actually had several students that didn't have indoor plumbing. They didn't have water. And so we wanted kids to be able to come to school and be clean and not be ostracized by their friends. And so that is a pretty striking story. And I don't want anybody to think that that's an everyday in the life of somebody who works in a school system. But I'm going to tell you that my first year I spent working as a school nurse was one of the most challenging years that I ever had, because I was learning things about environments that children were living in. And then I knew at the end of the day that I was sending them back to those environments. And they're not good. And so I was pretty disillusioned at the time. And actually somebody, I'm sure you've heard the Starfish on the beach story about the man walks down the beach and all these starfish had washed up on the shore, and there was a little boy there and he was throwing the starfishes back into the water. And the man said, "Why are you doing that? Look at all these starfish. They're dying. They're not going to live. And it doesn't matter what you're doing." And the little boy picked up a starfish and threw it back into the ocean and said, "It matters to this one." And that was a very helpful thing for me to hear, because, you know, I think all of us as nurses in particular, we do things for people one person at a time. a lot in our practice. And so I think that that's what kind of kept me going. But it really started me thinking that there's a lot of change that needs to happen. And we need to figure out ways to make that change. And so what we see a lot in the school districts are lack of access to healthcare. There's data on the Department of Education website where you can go and look, and you can see how many children in the districts where you live have their preventive health exams that they're required to have at kindergarten and at 6th grade. And I can tell you that consistently in lots of places around the state, you'll see that number at 6th grade at less than 50%. That's an indicator that kids don't have regular access to health care. And so there's lots of data out there that suggests we have gaps. And so collectively, we can do things to work on how to address those things. What we see a lot of in schools in general, or more than you would really, I think, care to realize goes on in this state, is food insecurity. We have family resource youth service centers across the whole state who every weekend send backpacks of food home with children because they don't have regular access to food on the weekends. Sex trafficking, abuse, homelessness, lack of access to care, as I mentioned, transportation issues, and so on. And here we are, it's 2021. And these are a lot of things that we should take a stand to say, this should be no child in the state of Kentucky. Yet it's very real issues for children across the Commonwealth. And so, what is advocacy? Well, advocacy is the act or process of supporting a cause or proposal. And we nurses, we do it every day, whether we're at the bedside or we're practicing someplace else. We are people who stand in the gap. We stand in the gap for the patients and populations that we work with. And the American Nurses Association talks about nurse advocacy. ANA believes that advocacy is the pillar of nursing. Nurses instinctively advocate for our patients. We advocate in our workplaces. Brittany just spent, a lot of time talking about the advocacy work that our organization, KNA, is involved in and we are involved in. We advocate in our communities. But what we all need to recognize, and everybody in this meeting today recognizes this because you're here, you care. Legislative and political advocacy is no less important to advancing the profession and patient care. And we're 90,000 strong in Kentucky, 90,000 strong. We have unions of other organizations that are that strong, and they affect change in the state. They have a say-so in the things that matter. And nurses collectively imagine what we could accomplish if we spoke with one voice and if we all spoke. And if we felt empowered to share the things that are important to us and discuss the things that are important to us in our communities, in our workplaces, and in our state. So for all of us, as far as advocacy, I do not consider myself a political person at all, but I end up in that arena because I think any of us who really are passionate about what we do, which many of us are, we find that we can't be silent about the things that matter the most. I think where all that starts is self-advocacy. And nurses, we are not always good with taking care of ourselves. We tend to put other people's needs ahead of our own. But in order for us to be strong and be able to be strong advocates for others, we have to be able to advocate for ourselves. And so I applaud the work that's gone on with ensuring that nurses have access to PPE, the nurses that have stood up to say, hey, you're testing everybody else for COVID. Why aren't you testing us? Those things are things we have to do as a profession. And then on a professional level, advocate for the things that we see need to change. Is this supported by science? Is this something that's just a horrifying issue that is not on anybody's radar? In the case of the situation I started talking about, the young man who had been placed in the custody of his 18-year-old brother, as it turns out, when he was placed in custody of his brother, there were a number of workers that were assigned that were supposed to be checking on these kids on a regular basis. But that didn't happen, and they didn't have anybody to stand in that gap for them. They didn't know how to advocate for themselves. And don't we end up doing that a lot? Don't we end up advocating for those people who can't or don't know how to advocate for themselves, or don't know how to navigate the system, or don't know how to take on things that seem too big and too overwhelming for them? And so where do you see the need for those changes? And what can you do to even bring awareness to whatever that situation is, or to the things? What can you do to make it different? How can you mobilize people that you work with, that are in your communities, or even on a larger level? Are you involved in these groups on a state level? We have, just speaking from the school nurse perspective, we have a school nurse work group that has been really studying this issue and looking for solutions to this issue. And we welcome people to be part of that work and part of that group to help us just make people understand where the issues are. Brittany had mentioned the work that we've done working toward having a nurse in every school. You know, one of the very first things that we were told is, well, how's this going to be funded? You need to figure out how to fund it. And you know what? We did that. We worked on ways to find funding to support these measures. And maybe it's not 100% of what the cost would be, but we certainly have been creative in looking for ways to help fund and make this sustainable, because it's so important for every child in the state. And if you look at Kentucky, who leads the nation in things that are not good, fortunately and unfortunately, being in a pandemic, you know, we're actually ahead of the country in a lot of things. And that speaks a lot to the work that's happened with Governor Beshear and the cabinet. And that's good. But we still lead the nation in things that are negative health indicators. We lead in obesity, we lead in heart disease, we lead in cancer, we still lead in tobacco use, we lead in abuse and neglect, we lead in mental health issues. And where do we change those behaviors? Well, we have to start with children. And so if we can impact health with our kids, then we can impact health across the whole state. And so maybe we don't go from being number one in the worst ranking to the best overnight, but we systematically start making change. And that focus needs to come with our children. The other thing with advocacy is, and I'm going to say this, and then I need you all to know that I'm the world's worst. But what I have learned is that it just takes time. Kathy Hager is on this meeting, and she knows that I just go on and on about how this needs to have happened yesterday. And she's good to remind me that things take time to happen and it takes time to change. And so we need to set goals, I think, as an organization and even on a personal level. But then you need to let yourself know that this isn't going to happen overnight. These things take time, and you've got to be persistent, and we've got to keep working and be constant with our message, and constant with the messaging, and constant with the people that we're talking to about the messaging, and build relationships with your legislators so they know the things that are important to you as a constituent, that through them you have a voice. And then you can be political without being political. Just as I said, know your legislators, know where they stand on issues, make sure they know where you stand on issues, and that they know who you are and the value that brings. You know, as I mentioned, Kentucky has data just even from the schools that suggest our children they lack regular access to health care. And when I say health care, I mean physical health, mental health, and actually social health. Kentucky's done work to address the social health issue. Back in 1990, when they enacted the Kentucky Education Reform Act, they created family resource service centers, and most schools in the state have Friskies, as they're called, have a Frisky center where they exist to be there to help meet family social needs. But we don't have that when it comes to children's physical health. And mental health was actually addressed somewhat in the school safety bill last year, which called for increased access for students to school counselors and protected the time that counselors had to spend with children counseling and guidance counseling. But there's no legislation, there's no requirement for children to have access to a school nurse. And actually, we have 172 school districts in Kentucky. Of those, 35 districts last year reported that they did not have any district hired or any contract nurses in their district at all. And we know that we have children with chronic health conditions that need access to a nurse at school. But we also know that every child needs access to a nurse for lots of reasons. But the access issue, KNA's first two priorities help address this, alleviating restrictions on nursing practice is very significant for our rural areas in particular. But I will tell you, I work right now in a very urban area and still see consistent lack of access to healthcare. So it's a need across our whole state. And then, of course, access to nurses. So there's work for all of us to do. I think if there's any message that I want for us to get today when it comes to advocacy, is that you are one person. Together, we are 90,000 people. One person can make a difference. 90,000 people can make a difference. One of the things that we've done when it comes to funding that will help for school nurses is in 2014, it was December of 2014, the federal Medicaid program reversed a rule that they had. So school districts can bill Medicaid, and it's school-based Medicaid billing. It's a separate type of Medicaid billing that you see with the managed care organizations and so on. It's specific to schools. And at that time, that billing was limited to only those students that were identified as having a disability. And so therefore they had what was called an individual education plan. And so if they had to receive a health service in that individual as part of that IEP, then that service could be billed. So it allowed for billing of things like speech therapy, physical therapy, occupational therapy. It could bill for nursing, excuse me, but that nursing was very specific to a procedure. So if a child needed suctioning, then that might be written into the child's IEP, and the nurse could bill for that moment in time. But it wasn't a systemic. It wasn't something that really could fund additional staff. So CMS in December of 2014 issued a statement and said, basically, we were wrong. We were wrong to have limited that to just students with an IEP. Actually, that billing should apply to any child in a school district that has Medicaid. And so there's been a lot of work done to advocate for that change, because in order for Kentucky to take advantage of that billing opportunity, they had to amend the state Medicaid plan, which was reversal of the free care rule that would Kentucky's, our state plan had actually limited that billing to what was in a student's IEP as well. And so amendment of the state plan would open up to allow for expanded billing of services for kids in schools. It's called the free care rule because the service offered to a student with Medicaid also has to be offered to a student that doesn't have Medicaid. So it's something that actually would impact the entire population. And it took several years, but Kentucky did amend the state plan. They submitted a state plan amendment just over a year ago. And in October of last year, it's been beyond a year ago, because in October of last year, that state plan amendment was approved. And so districts could start billing for this expanded service. That's been a slow rollout in Kentucky, really, because kids haven't been back to in-person learning. But it greatly increases the opportunity to provide those health services in schools and to bill for those services, which will help create a sustainable model. And so that started with, I can tell you where I was standing.
Dr. Stone. Dr.
Yes.
Stone, we want to learn more, but your time is up.
Oh, well, I'm finished. I'm so sorry.
Thank you so much. You have so much to share, but and I know that you can talk on this subject for days at a time. But
well, I wasn't even looking, but I was on my last slide, and I thought, oh, I'm way too early. So, thank you, Delanor.
Thank you, Eva.
That's great. Thank you, Eva. Great presentation, and it really hits that heart of that what we do individually as we work. We are advocating for patients, but as a group, we can advocate for many issues together and have a great unified voice. So very much appreciate that presentation. Next, we are going to hear from Dr. Sheila Shuster. Dr. Shuster is our KNA lobbyist. She's a licensed clinical psychologist with graduate degrees from Purdue University and the University of Louisville. After 27 years of practice as a child psychologist, Dr. Shuster now devotes her full-time work to public policy advocacy on mental health and disabilities, healthcare, and social justice issues. She's our KNA lobbyist and advocates for nurses and those in our care. So I'm going to turn it over to Dr. Shuster. Thank you very much. And tell us how on earth we speak to.
Thank you so much, Donna, and hello to all of you. I wish we were in Frankfurt, but none of us are allowed in those buildings because of COVID. So I'm thrilled to see the number of people that are here. And although Eva and I did not talk about our talks before today, I think what you're going to hear from me is very much an extension of what you heard from her, because I would define advocacy as education with passion. So I think nurses, I love working with nurses. My daughter's a nurse. My aunt was nursing faculty at the University of Missouri, and you all have such passion for your patients and for your profession. I think the same is true of psychologists. And so there's a lot of synergy, I think, between those two professions. So I know that people get very scared about meeting with legislators, about talking with legislators. I put in the chat box the way for you to find out who your legislators are. So you go to the Legislative Research Commission website, www.legislature.ky.gov, and there's a drop-down box that says legislators, and one of the tabs on that is find your legislator. And they've made it very easy. There's a map of Kentucky. You type in your home address, because you are a constituent of your senator and representative on the basis of where you live. And their little pictures will pop up when you've entered your home address. And if you tap on the picture, it will take you to their webpage, a legislative webpage, and you can find out all kinds of background about them. I really advise you to do that. It'll have their picture. It will tell you what their educational background is. Some of them have their religious background, if that's important as a connector. We'll tell you some of the civic groups that they belong to. We'll also tell you how long they've been in the legislature and what committees they're on. We'll also give you their legislative email address. We'll tell you, many of them still put their home address on. We'll also tell you where their office is in the Capitol Annex. So you can get a head start. They also have their Twitter handle on, and many, many more of them are using social media. So that's another way to connect with and to follow your legislators. A lot of them have Facebook pages. And I recommend it. It gives you a way to kind of know what they're interested in before you have a chance to meet with them. One of the great things about an organization like the Kentucky Nurses Association is that it does a lot of this for you. So we follow legislation. You heard from Dr. Brittany Welch, who does a fantastic job of chairing the government relations cabinet. I'm a consultant to that as your lobbyist. And she and that cabinet work to review bills. We have a bill grid that we follow. We vote on the priorities set for the Kentucky Nurses Association and send those to the board, who makes the final decision, so that we're all on the same page. And I think that's a message that you heard from Eva. Your voice can make a difference, and I could tell you lots of stories about an individual's voice making a difference. But think about the power of 90,000 nurses. Think about what a voting block that would be and how much you would be joined. The other thing is, think about the people that you work with who are not nurses, perhaps, and think about family members. You know, the more people you have giving the same message to the same legislators, the more powerful it is. So there is strength in numbers. And I think nurses are on the brink of really exercising that advocacy muscle. If you can meet in person with legislators, that certainly is preferable. During COVID, many of them are arranging meetings via Zoom. You'll have an opportunity, some of you, to meet with some legislators via Zoom. You can also call their legislative office and ask for the receptionist to send a message to your legislator. If you're introducing yourself to your legislator for the first time, I would recommend using their LRC email address. And in the subject line, put, "I am your constituent." Now, don't do that for 138 legislators or you lose your credibility. Only send that kind of an email to your representative and to your senator. And then you want to put your home address in the body of your email. Your communications should be fairly short and to the point. I know it will surprise some of you, but most of the legislators really have very little staff. They don't have individual staff members assigned to them unless they're a committee chair. So you will have one receptionist that may be taking all of the phone messages for 4 or 5 legislators. And so they do most of their own research. If you come to them with a suggestion about a bill, about a bill that you want to have put forward in the General Assembly, you need to do some of that background research, if you can, about what the problem is and what you think the solution might be. It's very helpful to let your legislator know what your background is. I'm Donna Metter. I'm a nurse. I'm with the Kentucky Nurses Association. I live in, I don't know where you live, Donna. I live in Lexington. And I work for, you can also make a connection with legislators on the basis of where you work. So if you want to contact a legislator whose district has the hospital where you work, even though you don't live there, you can also make a connection with a legislator by saying, "I'm not your voting constituent, but I do work with your constituents. I serve your constituents in my nursing duties at Flagey Hospital in Paducah," or whatever that hospital is. Or I have a practice, you're a nurse practitioner, and I have a practice that's in your district. And so I'm bringing economic development. I'm hiring people. I have a payroll, I provide services to your constituent. You want to make a connection with your legislator like you would with anybody that you want to do business with. So you want to try to find some things where you can resonate and share some activities, some similarities. I had a nurse practitioner with me one time in Frankfurt, and I needed to see a senator. She was not a constituent, but she went with me, and I introduced her. And they got to chatting like you would with anybody that you're meeting for the first time. And it turned out that her grandmother actually had a farm adjacent to this legislator's farm. And they made that connection. And he would see me later in the session and say, you know, have you seen so-and-so? You know, it was important to him to know that there was that connection. I always say to people, if you have a connection with a legislator that you can contact, you have their cell phone number, you live next door to them, whatever, it's really, really helpful to me as your lobbyist for me to know that connection, because that gives me the opportunity to say to that legislator, you know, I know that Delano Manson is your constituent. I work closely with Delano at the Kentucky Nurses Association. One of the things that I think is hard for people because you are nervous and you want to get to your issue, but sometimes legislators just like to talk to you. And so be patient. You want to listen. You sometimes can get some clues. You could go in thinking you're going to talk about evacuating surgical smoke, and they want to talk about veterans issues. Well, it turns out that there may be some priorities and some issues that KNA is interested in that also would benefit veterans. And so that's a helpful piece of information and something for you to remember. The other thing that I think is very hard because we're passionate about our issues is sometimes we have to hear no. Sometimes legislators will look you right in the face and say, I can't go there. I just don't agree with this bill, or I have a problem with it, or I've heard other things, or whatever. And when you're passionate about something, it's really hard to hear that no. Believe me, I've been going to Frankfurt for over 40 years, and I still find it hard to hear a no from a legislator. Don't let it get to you in the sense that you burn that bridge. You don't want to make this personal between you and the legislator. You're going to have differences of opinion, even within the nursing community, even within your membership in KNA, and you are undoubtedly going to have some differences of opinions between you and your legislators. What you want is for your legislator to hear you openly, to hear your position, and to be honest with you. You know, I always say to a legislator, I'd much rather know that you're against us and see if I can address those issues than for me not to have any sense of where you are on this issue. So sometimes that's hard to hear. I have seen advocates who were so passionate really lose it, get mad at a legislator, you know, say bad things about a legislator. You sure don't want to do that. You know, you've heard the old saying, politics makes strange bedfellows. Very often a legislator that I have disagreed with or has disagreed with my position on X, I come back and work with very closely on Y. And sometimes it happens in the same session. So you have to be able to kind of compartmentalize a little bit. You know, they're not with me on this issue, but I still need that vote in the Senate or in the House on this other issue. So I'm going to go back and talk again with the legislator on that other issue. I think you cannot underestimate how in what high esteem nurses are held. We had 5 town hall meetings during September or August, September, October, and we heard that from every legislator and every candidate that appeared. They said basically, you all are the experts. You tell us what we need to know about this issue, about healthcare access. Access is a huge issue, particularly in our rural communities, but as Eva pointed out, even in our urban underserved areas. One of the facts that we put out there about nurse practitioners, there are 87 HPSA areas. For those of you that know, that's the health provider shortage areas that are set by the federal government. We have nurse practitioners in every one of those 87 HPSA areas. So we can say to legislators, remove the Kappa CS as a barrier and let us provide the care to your constituents. So you want to you know, follow up on that and be available to them. Eva talked about patience. I always say to people, this is a marathon and not a sprint. It's very, very unlikely. I've seen it happen occasionally that somebody comes in with a great idea, gets a legislator to put the bill out there and they pass it in one session. almost all of the big victories that we've had with nursing, with psychology, generally with access to care, have taken more than one session. Our OR smoke bill came out of the Senate with not a single no vote last session, and we thought we were well on the way. And then it died over in the House because COVID struck, and all they could think about, even though the OR smoke issue does have to do with COVID, they just couldn't take up some of these bills. So sometimes you have everything going for you, but it still doesn't work out. So you need that patience. You need to be persistent without being a pain in the neck. So you can be polite. You want to be pleasant. My reputation is that I'm pretty much smiling all the time when I'm in Frankfurt. I always say I'm trying to spread good mental health. I may not be smiling on the inside, but I'm trying to be pleasant. But I'm also going to be persistent, and I'm going to keep waiting until I get an answer, keep coming back with new facts and so forth. You don't want to be pushy. There's a difference, again, between being persistent and listening to your legislator and just being rude and pushy. If you're told that the legislator doesn't have time to meet with you, ask if there's some other way that you can get information to him or her. Is there a different email address that you might use besides the Legislative Research Commission? Is there, excuse me, is there receptionists available to take your information and pass it along to the legislator? Can you make an appointment with them when they're home on the weekend? You know, they are there to represent you, and it is not inappropriate to say, you know, I know you're busy when you're in Frankfurt, but could we have coffee on Saturday or on Sunday after church or whatever? Many of them are open to that because they want to please you. You know, you have great power as a constituent because you can vote to re-elect them to be the senator or representative. You can also vote them out of office. And so you have much more power than I do as a lobbyist. I only have that voting power for my representative and my senator, but you have tremendous power as a constituent. You don't want to be threatening to a legislator. I've, again, out of passion, heard people say, you know, if you don't vote with us, this is, you know, you're going to be in trouble in your district, you know, as if you're threatening to have bring opposition and so forth. You don't want to do that. You want to be straightforward. One of the things you don't want to do is to pull an answer out of your left ear. You might have been the best BSer, test taker, essay writer, but when a legislator asks you a question and you don't know the answer, just fess up. You know, I know the demand characteristic is for you to come up with an answer, but you really don't want to give them wrong information. So what you want to do is to say, Senator, that is a great question, and I don't have the answer to it. And here's the beauty of it. It gives you a second bite at the apple, gives you a chance to say to the senator, I want to research it and get that answer for you. What's the best way for me to be back in touch with you to get you that information? Or something that really benefits me is for you to say, we work with Sheila Shuster as our lobbyist. Could I have her get back with you with that information? And that gives me a connection again with that legislator. I can go to senator and say, I understand your constituent asked this question about our bill, and here's the answer for you. So again, sit on the impulse, if you will, to kind of pull something out and just say, that's it. Finally, and I'm going to wrap up here so we have time for some questions, but don't forget to thank your legislator. These are part-time legislators. They are not getting rich doing this. They also have other lives. And if they take the time to meet with you or to respond to your email or to your letter, you really want to thank them. And I always think that the best thank you, and I know Deliner is great about this, is writing handwritten little thank you note to their Frankfurt office or to their home address. That's been my trademark over 40 years. I've probably bought every kind of thank you note that there is that Hallmark puts out, but it's really important to them that you have acknowledged their time and energy. And finally, I just want to say again that do not underestimate your power as a nurse or a nursing student. You belong to the most trusted profession. Year after year after year, nursing is voted as the most trusted profession, and you have that as a leg up, and you already have the passion to serve people. Eva is a great example of that. We have many others throughout the nursing profession, and you all have stepped forward during COVID, and legislators are grateful to that. I've heard that from them. The lieutenant governor is going to be on this afternoon, and one of the main reasons is that she wants to be able to thank nurses for what they've done. So I thank you, and we'll open it up for questions at this point. Thank you, Donna.
Thank you, Dr. Shuster. That was excellent. You have lots of good comments there in the chat box, and thanking you and acknowledging that we are blessed to have you working with us and our entire Commonwealth in all the different areas where you advocate. I did not see any questions in the chat box for Dr. Shuster. Does anybody have a question? Does anybody want to pop a question in there? I did see a question for Dr. Stone, which she answered. So the question was, if someone wanted to help promote change on a small local level, and this is from Suzanne Stewart, where and how would Dr. Stone suggest to start? And her answer I thought was excellent. It was to advocate for change on a local level is to start with what you feel strongly about and gather all of the information you can, then find your allies. Figure out who you need to talk to and start there. So I think that was a great little piece about how to get started in advocating for change on a local level.
Donna, I did see where somebody asked for my contact information. It's very easy. It's kyadvocacy@gmail.com. kyadvocacy@gmail.com. Thank you.
And Sheila, if you would put that in the chat box, that
Well,
would be
I
helpful.
tried, but it looks like it would only go privately. I'm trying to figure out how to do that.
Scroll up to the top where it says everyone.
I got it.
Erica Limburger has a question. And Erica, we will get her open so she can ask her question. 1 second, Erica. We will get you there. Hey, Erica, if you will unmute.
For the nurse practitioner legislation for the Kappa CS, is there anyone specifically that you think that would be influential for us to speak to? Someone on a committee, other than our personal legislator? My legislator is Julie Rocky Adams. I know that she's supportive of it.
Absolutely.
My representative's Tina Bojanowski, but because in years past, I brought my entire class to come and speak with legislators. I just didn't know if there was a way to be effective or strategic with speaking to certain legislators for the issues that we're working on this year.
Thank you for that question, Erica. The bill will be heard in the Senate Licensing and Occupations Committee. We hope next Tuesday, a week from today. And so you could go to the website, the LRC website, and see the list of committee members. And I would say messages to any and all of those committee members would be very, very important. In fact, we will probably be sending out an action alert to KNA members. We want to target the committee to get it out of committee and then to the floor of the Senate. So any of those legislators on there, we have several co-sponsors on there, so you can thank them. Senator Julie Rocky Adams is on that committee, but Senator Hornback is a co-sponsor. Senator Karen Berg is a co-sponsor. So again, you cannot thank legislators enough when they step forward and put their name on a bill, but that's a great question and we appreciate your advocacy.
There's also a question from Jillian Champion in the chat box. So I don't know if you want to unmute Jillian and ask and let her ask her question, or if we just want to read it out of the chat box.
I unmuted Jillian so she could ask her question. Also, I want to encourage while Jillian is unmuting, I would like to encourage everyone to download the KNA 365 app, because that is where we will be sending a lot of our legislative alerts. So, and you will get those quickly if you will download that app. Jillian, are you?
Hi, Dr. Schuster.
Hi,
I was
Jillian.
wondering I have a first cousin who is a representative. He is not in my district. He lives further away from me. Is it appropriate for me to use him, even though he's family, to advocate for changes?
Absolutely.
I just
Let's not call it using him.
Okay.
Okay.
Sure.
Absolutely appropriate for you to reach out to him and say, you know, I'm with the Kentucky Nurses Association, and these are our issues, and I'd like to get a feel from you about, you know, and he may be willing to share information back with you about questions. You know, the most important thing would be if he hears questions from fellow legislators about our legislation, that we could get answers through you to him, to those legislators. That would be, and if you want to text me offline and tell me who your cousin is, that would be helpful.
Sure. I will. Thank you.
Thank you. All right.
Also, I wonder, the legislators that we have in breakout rooms, are any of those folks on do we know if any of them are on the Senate Licensing and Occupations Committee? I had one specifically ask me about the Kappa CS, and it's somebody that I know personally very well. And she asked me what my opinion was. I don't know if she's on that committee or not, but I have a feeling she may be. So do we know?
Senator Gerald Neal is on the Licensing and Occupations Committee. And I have talked with him personally, but he would be great to talk to about it. I think he's with us on that committee. All of the other members are House members, but
Right.
I believe Susan Westrom would be important because she's on the House L&O committee, Donna. So
Okay.
when it comes over to the House, and I believe that I'll have to check. I think maybe Jennifer Decker, who is a new representative from Shelby County, may also be on the L&O committee in the House.
Okay.
So the House doesn't have our bill yet. The House is just now getting Senate Bill 38, which is the OR smoke bill, because it came out of the Senate. But we're still over in the Senate on the Kappa CS bill, which is Senate Bill 78. But that's a great question.
Also, for those of you, since we have so many nurses on the call, I worked with Representative Melinda Gibbons-Prunty. She sits on the Colon Cancer Advisory Committee that the state runs. And so if any of you all have that as a particularly if you are OR, peri-op nurses who can get very involved in colon cancer and colon cancer prevention, she is an excellent advocate for that. She's been very active with that committee for several years. So it's kind of a random comment there, but
No.
Any other questions? Okay. And Dr. Welch has a comment in the chat box in case you haven't seen it. For the SANE bill, the data collected will show how many assaults, who's treating those assaults, the number of SANE nurses and their employment status, whether it's full-time, part-time, or contract, and recommendations for increasing the number of SANE, such as increased reimbursement. So.
Right.
All right, we have 2 more minutes until break. Do we have any other questions or comments? Anybody need to raise their hand or put a question in the chat box? Okay. Well, thank you all very much. Thank you, Dr. Shuster, for being with us. Thank you, Dr. Stone, for your great words. We are going to take a short bio break here, and whatever kind of break you need, please do join us back at 10:30 when we come back together. We're going to meet our legislators in breakout rooms. So we will see everybody at 10:30 promptly.